Hi there, INRICH colleagues. There can be no keener revelation of a society's soul than the way it treats its children. If you subscribe to Mandela's sentiment, then our Child of the North report paints a vulgar picture of our nation's soul. It was launched in Parliament at the beginning of the year, put together by collaboration of academics, 40 academics across the north of England, and myself and Kate Pickett led the development of the report. It shows that children in the north of England get a bad deal. It shows how the north-south divide in child health explains the north-south divide in adult health and thus economic productivity. And it shows how it's been made worse by the pandemic and outlines what we need to do to address the problem. We do badly in the UK, in England, on a number of metrics, continue to slip down international rankings. Here you see child poverty against levels of under 5 mortality. The UK has the highest under 5 mortality in Western Europe. The US here is an outlier. But one of the reasons we do poorly is that disadvantaged children have particularly bad outcomes. And pre-pandemic, there was a crisis already. The large and persistent inequalities that we see in the UK were getting worse, such that if you take the life expectancy of a child born in Kensington and Liverpool, around the corner from here, one of the most disadvantaged areas in the country, compared to the life expectancy in Kensington in London, an affluent area, there's a gap of around 10 years. When you extend this to healthy life expectancy, so-called years lived in good health, it's 20 years, 20-year gap. And these are health inequalities. We know there's nothing natural about them. They're a consequence of how we choose to organize society. They're profoundly unjust, and we can do something about them through the organized efforts of society. And by and large, we know what causes inequalities. The causes are the same. They come back to differences in exposure to poverty, power, resources needed for health, differences in exposure to health damaging environments, protective conditions and positive health factors, and especially the conditions that give all children the best start in life. And our report shows that children in the north are more likely to live in poverty than in the rest of England, and increasingly so. And poverty is a major driver of differences in health outcomes, leading to worse physical and mental health outcomes, educational attainment, and lower lifelong economic productivity. The report highlights how pre-pandemic lopsided policy choices, particularly those implemented under the banner of austerity, led to rising child poverty and also led to bigger cuts to local government budgets, falling more heavily on disadvantaged rather than affluent areas, on the north rather than the south, and on more vulnerable population groups such as children. You can see this illustrated in this plot in terms of the local government cuts. We know that it's the accumulation and clustering of multiple risks caused by poverty that themselves lead to adverse outcomes. That's the especially pathogenic aspect of living in child poverty. And if you're interested in reading more about these pathways, have a look at our review. Here's a conceptual model based upon Finn Diedrichson's model. We know how socioeconomic conditions, poverty, lead to differential exposure and susceptibility to a whole range of risk factors that then go on to influence health. And we know a lot now about how these factors get under the skin. So let me show you some data from some recent analyses where we've tried to look at this relationship. How do social conditions structure exposure to adversity? And in this paper, we look at how that influences mortality. This is a study that we did in using Danish linked data, study of over 1 million children, where using linkage in Denmark, you can instrument all of these adversities measured precisely in national registries on a yearly basis. And we characterized kids' exposures to all of these on an annual basis up to the age of 16, and then went on to look at mortality in those groups. So first of all, it's evident that these adversities do indeed cluster with social disadvantage in Denmark. And then using some statistical modelling, we can categorize children's experience of these adversities. So in Denmark, there's a low adversity group with low levels of material deprivation, loss or threat of loss, and adverse family dynamics. 20% of kids, early life poverty, 13% of kids, persistent poverty, 10% of kids experience high levels of loss or threat of loss. And then there's a small high adversity group with high levels of all of these adversities. And then we did a survival analysis from 16 onwards using those categories as exposures. Here's the reference population of about half the Danish children. Persistent poverty causes an 50% increase in risk of death during follow-up in early adulthood. Overlying each other, you see the persistent poverty group and the high levels of loss or threat of loss in families, double risk of death in adulthood. And here's the high adversity group, 4 to 5 times the risk of death, all playing out in the registry data. What these children dying, now become young adults dying of, well, the things you'd imagine in this age group: suicide, accidents, but also an increased risk of cancer. We show in another analysis that these adversities drive high and characteristic patterns of hospital admission through childhood and into early adulthood, particularly for mental health admissions. And then in this paper, we look at how much of the inequality in mortality in Denmark is explained by these childhood adversities. And to cut to the punchline, we find that experience of these adversities, the limited number that we can instrument in the data, explains half of the inequality in early adult mortality, which is worrying for contexts like the UK and Denmark, where there's high levels of adversity and less social support. We've done a similar study in UK data using the Millennium Cohort Study. We're able to characterize children's long-term exposure to various adversities, including poverty, in Millennium Cohort Study. And these are the groups that emerge. In the UK, 40% of kids, low levels of adversity and poverty. These are the striking groups that emerge. 23% of kids always in poverty up to age 14. 12% always exposed to parental mental health problems, and around 11% of children exposed to both poverty and parental mental health problems. And it's actually this cluster that emerges as being particularly harmful for a whole range of child health outcomes. This is the relationship with mental health problems in the next generation, increasing the odds of mental health problems 6 to 8-fold. And then we calculated population attributable risks. So what would happen to the burden of mental health problems in the UK if we reduced levels of poverty and adversity to the same level as this group, the 43% with low levels of poverty and adversity? And basically we show that you could get rid of half of the mental health problems in adolescence in the UK and a big chunk of all of the other problems that children face: obesity, cognitive disability. In the Child of the North report, we show the patterning of persistent poverty and/or parental mental health problems. Over half of kids in areas of the North exposed to these adversities, almost 60% in Yorkshire and Humber. We go on to show that rising poverty is fueling the very adversity that leads to children ending up in the care system. There's been a huge rise in England, and we show that there's been inequalities in this rise in children being taken into the care system. And in this recent analysis just out in the Lancet Public Health, we show that almost 10% of care entries between 2015 and 2020, that's 10,000 children, caused by rising levels of child poverty. And so, I mean, the pandemic hit in the midst of this worrying situation: rising toxic stress in families, disruption of protective services in health and social care, layered over it local areas that were ill-equipped to deal with demand pre-crisis. And so as our report shows, children in the north spent more time in lockdown under more difficult circumstances. They had to cope with worse digital access, more food poverty, etc. And so it's not surprising that the pandemic has supercharged inequalities in aspects of children's health. If we take the modern epidemics of childhood, mental health problems and obesity, this shows mental health problems in England pre and during pandemic, and you can, by deprivation quintile, you can see a rise in the absolute level and a rise in the absolute inequalities. And actually we see something very similar for obesity in children aged 5. You can see pre-pandemic inequalities in obesity were gradually increasing, and they've been massively increased since the pandemic. The inequalities gap has doubled. What do we need to do to tackle this crisis? Well, first, we must reduce child poverty and back a social security system that ensures an adequate quality of life for all families with children. This shows the data on poverty over the pandemic period by deprivation quintile. In England, pre-pandemic, children in the most deprived parts of the country were moving into poverty based on any measure. But in the latest data, there was a reduction, and that was as a result of the government's £20 universal credit uplift. So benefits were increased for a period during the pandemic. But we know now that's been cut. This uplift in benefits has been cut, and we will see the impacts of health of this. Our modelling actually shows that it will lead to an extra 1,500 children entering care per year. We know that the financial costs of child poverty are vast. This report from the US estimated these costs at $1 trillion per year, 1/20th of GDP. Rising child poverty in the UK should concern anyone who cares about our economy. The UN said that child poverty in the UK was not just a disgrace, but a social calamity and an economic disaster. Secondly, we need a fresh commitment to proportional universalism. We need to reverse the trends that we've seen in cuts to services that support children. We need to go backwards in time to a more proportionate allocation of resources for children at local government level. We took young people to launch the report from the north of England, in line with our argument that we need to protect children's rights and put children's voices at the centre of the conversation. We're bad at protecting children's rights in the UK, according to the UN, on the basis of our high levels of discrimination in policy against children based on ethnicity, disability, and fiscal and welfare policies that disproportionately impact younger generations. The Child of the North report is going to be followed up by an all-party parliamentary group that will look at the recommendations, and we hope that this will put children's well-being at the heart of government policy. We know, people who live in the north, that to be northern is to be blessed. It's the rolling hills, the lakes, the peaks, it's the industrial powerhouses of Liverpool, Sheffield, Manchester, Leeds, it's the countryside, Teesside, Tyneside, hundreds of seasides. And our kids in the north have this amazing potential. They just need the right conditions to let them flourish. And this is the northern powerhouse waiting to be levelled up. Thank you.